a second article coming from Taipei, Dr. Zhu and colleagues. In this second article, rituximab as the treatment for pemphigus vulgaris, for severe pemphigus vulgaris, was taken into consideration. We all treat our patients with rituximab as an anti-B-cell antibody treatment. So we decide to give 1 or 2 cycles, but then it is sometimes hard to see which patients will need a retreatment in the future, how long they will have to be treated. So what this group did actually is looking at their collection of patients, 123 patients, retrospectively, having a median follow-up time of 87 months. And they wanted to see whether there is a pattern in predictive factors for the need of new rituximab treatments. So the majority of their patients got 1 or 2 cycles, and 1 patient even got 5 cycles, and some of them were, after the cycles, immediately put on concomitant treatment with azathioprine. So they put all the patients together, and what they see is that concomitant azathioprine as a co-treatment may help favorable long-term outcomes, so in terms of disease remission. Also, repeated rituximab courses may also prolong complete remission. Patient characteristics like having a larger skin area affected, higher disease activity in terms of blistering, having diabetes, and also having pre-treatment higher platelet counts or negative prognostic factors. So whenever you have patients with these factors present, you might already from the beginning talk about probably you will need more rituximab treatments. I wasn't sure about the link to higher platelet counts. I did not really see any connection with rituximab, and I was also wondering whether the authors excluded pre-existent platelet disorders in their 123 patients. That was a critical note of myself. Last but not least, they admit that a limitation of the retrospective study is that they did not measure anti-desmoglein serum titers, so the antibodies present in pemphigus, which in my experience and experience of others is definitely also predictive for not having controlled or for developing flares of the disease. So that is a minor point in this publication.